This year we're considering funding almost 20 projects. So this is our largest project base we've ever had. So because of everyone's generosity, we've been able to raise it up to the next level. So it's been amazing.
The Stryker wheelchair is a smooth, easy, accessible wheelchair for the patient to get in and out of, as well as for staff to use. It includes an oxygen tank as well as a IV pole to make transferring easier. We're often having to try and find a wheelchair that's wider or higher weight, or even one of our wheelchairs with the higher handles where the Stryker wheelchair already has those, which makes pushing a larger patient easier.
So we reached out and asked for an ultrasound machine to help with our IV starts. So what the ultrasound machine will do is it helps us to visualize patients' veins underneath their skin. Anytime we have to do less painful procedures or just less procedures in general to kids, it makes their hospital stay more calm. It makes it a little bit more positive. And we like to try and make it as positive as we can. So if it's really important that we need this IV access, having our own machine will obviously make it readily available. If we didn't have this committee, the possibility of having this machine probably wouldn't exist.
But we asked for the Clear Sight from the Peers Foundation. This data will not only allow us to be able to have a quicker response to that patient, but it would also really help the patient with decreasing their mortality risk, and also allows us to treat effectively and efficiently to prevent a widespread infection. Using the Clear Sight will allow us to treat any patient population. It is non-invasive, so it's using a wrist and a finger, and allows us to get accurate, detailed vital signs to be able to adjust their treatment plan for that patient.
One of the peer requests we had in the critical care unit was our cooling blanket. So the cooling blanket we can use for different patient populations. One of the big patient populations that we do use it in is our neuro patients. So any type of neuro injury, sometimes we have a difficult time managing their temperatures. Unfortunately, medications, ice packs, stuff like that doesn't always keep the temperature down. So in that case, then we would resort to our cooling blanket to help manage those temperatures in the patients. Another patient population that we'll use these in is our post-cardiac arrest patients. It's a type of non-invasive cooling device that we can use to help preserve that brain activity after a cardiac arrest. Typically, we'll have these patients on the cooling blanket for about 24 hours before we do further testing. It decreases that risk for infection, and it typically works pretty rapidly to decrease those temperatures to the target goal that the physician will want in these patients.
You never know when you might think of something that your department could benefit from that could be funded by the Peers Committee, and if you're giving to it, it's a good way to purchase things that maybe aren't affordable for your department.